you.
Right now. Okay then.
You.
Right now.
あら、もう始まってる。こっちに。
Okay. Okay then. Right.
You.
Right now.
あら、もう始まってる。こっちに。
Okay.
You.
Right now.
あら、もう始まってる。こっちに。
Okay.
はい。
Right now.
あら、もう始まってる。こっちに。
Okay.
Hey, can you mute them? Maybe I should say this. All right. Hi, everyone. It's 7:31 now, and we are going to begin. Good evening. こんにちは。にhao, nei hao, annyeonghaseyo. All right. So welcome to COVID-19 Information Night. My name is Dr. Saki. I am one of the vice co-chairs of this organization called COVID-19, standing for Coronavirus Navigation. And this is actually an organization that just got launched in February 2021 in Japan to provide accurate information of COVID-19 and COVID-19 vaccines based on science. And that goes in line with recommendations of WHO, CDC, Ministry of Health guidance as well. Because there's so many information out there, and people might find challenges finding the accurate information. And we are a group of doctors, both in the US and Japan, nurses, epidemiologists, and wonderful designers and medical students as well. And we usually deliver information in Japanese, but we wanted to do this in English today so that we can reach people whom Japanese might not be their first language. Because foreigners are very important to us in Japan. I really want to thank you for making Japan a more diverse country and allowing our children to have multicultural experiences. So thank you. So I am actually a doctor working in the US. I specialize in pediatric infectious disease, and I myself is a minority here since I am Japanese citizen, Asian, a single mom, and female. And so so it has been hard sometimes as a minority, but at least I can speak the language and I know the medical system well. But for those who don't know that, I don't know, I cannot imagine what you're going through. It must be really hard for you. So we'll have fun tonight, and please, in the chat box, in the YouTube, we want to make this very inclusive and happy. If you want to could write down where you're from in the YouTube chat box, this will be great. Anyways, so I am joined today by special guests, Dr. Nicholas Rennick and Dr. Kazuaki Jindai. Dr. Nick, if you could introduce yourself first.
Hi everyone, I'm Nick Rennick. I'm an Australian GP.
What does GP mean?
A GP is a general practitioner. So we don't have the same kind of thing as much in Japan, but in Japanese, usually called katei or sogo shindoi. And so I've just come to Japan last year, just in time for coronavirus. So I literally migrated in like January, 2020. So I've lived my whole life in Japan with this coronavirus situation. And now I work at NTT Hospital in Gotanda in the Department of International Healthcare there, and the Department of General Medicine. And yeah, first time doing a YouTube live, so very exciting. And I hope that I can give some good information to you guys.
All right, that sounds exciting. We would love to hear your experiences. All right, now, Dr. Jindai.
皆さん、こんにちは。Hi, my name is Kazu Jindai. Hi, I'm infectious disease doc, like Saki Sensei, and I was trained in the United States and in Japan as well. But over the couple of years, I do my like public health and epidemiology research in addition to some clinical works. And especially over the last year, I'm involved in epidemiology response in COVID-19, namely cluster task force. And right now I'm working for actually Dr. Oshitani at Tohoku University, and I'm a staff there. And I as a work in a primary care setting like GP, as the Nick Sensei mentioned, then I finally got some vaccines even to medical workers working in non-tertiary care centers. But anyhow, I'm glad that this is my first time in a YouTube live, and I'm glad that I would like to learn from you, and then I'd like to say something about the vaccines for you guys. Thanks.
Thank you so much. I'm really excited to learn from you too, because you have been involved in like contact tracing, cluster management, working with the Ministry of Health too. So that's a very, very unique experience that I would love to hear about. All right, so the goal of this YouTube Live today is to provide information of COVID-19 vaccines in English. And, because we want you to be prepared when you become eligible, because we all have, equal rights to health, and we don't want anyone left behind in this pandemic and vaccination strategy program in Japan. All right, so what's going to happen is I'm going to ask each one of our special guests questions to share experiences. You're very welcome to post additional questions in the YouTube chat box. And then after that, I will give like a brief overview of what to expect in the process of receiving the vaccines, just covering the basics. And some people who are listening to us right now may have more helpful information. So if you have great resources, feel free to add that in the chat box as well. All right. So I'd like to start with Dr. Rennick. I'm going to call you Nick.
Yeah. all my patients do. Everyone does. So yeah.
Okay, perfect, Nick. And everyone can call me Saki. And I'm going to ask some questions in the YouTube chat box too. But I think everyone is curious to know more about your background, like why you are so fluent. I mean, I think if you're following, if people are following your Twitter, I think they know that you are very fluent in Japanese too, and why you're fluent and why you decided to come to Japan to practice.
So I guess I've always had a connection with Japan. When I was 15, I came for a 3-month exchange to Japan. So that was my first experience, and I was just
was that through your school?
Yes, yeah. So high school. So it was in Saitama, and basically I just got off the plane, and the first place we went to was konbini, and konbini, and there's like fried chicken and onigiri, and there's bento and nikuma and everything, and I was like, this is where I need to live. Yeah,
I miss the bomb kuchen of konbini.
Yeah, so it was just such an exciting place to be. And then in university, I met my wife, who's Japanese as well. We lived in Australia for many years together, and I always thought, what, I would love to live in Japan and work there. But it was quite challenging because as a doctor, Japan has bilateral agreements with several countries like America and the UK, where you can kind of work without getting a full Japanese medical license. But Australia has no agreement at all, so you have to redo the entire licensing process in Japanese. So it was a challenge. But my wife's Japanese, so she's been yelling at me in Japanese for many, many years, and just studying, and I just decided to move last year and sit the exams and passed, and here I am. So it's very exciting.
Wow, like
being an Australian doctor here.
Yeah, learning all these medical terms in kanji.
It was hard.
In Japanese, I cannot imagine. Oh my gosh. We have a comment saying, Dr. Rennick, great to see you, an Aussie doc in town, needed, fellow Aussie here. So that's great.
Yes, great to have an Aussie in the audience. It seems like there's lots of us here in Tokyo, so it makes me feel really, really at home.
That's great. Yeah, there must be so many foreigners in Tokyo, Japan too, and many of them do speak Japanese, I would think. Is that the correct understanding, or what's your impression?
Yes, certainly the contact I've had with the international community is that a lot of people actually find that you can get by quite well without learning Japanese. And it works, people's lifestyle works quite well with the international community. We kind of look after each other. But I think when there's suddenly an unexpected pandemic and the news is constantly having information only in Japanese, and things are changing quickly, that was a bit of a shock. So I think for the international community, there was a bit of information isolation there, and I guess this event, which I think is a great idea, is part of trying to overcome that. Like isolation really, gets you. Like it's really hard. I've been a single mom here, so like suddenly people are saying we cannot get in touch with others and we have to isolate ourselves in a little pod or bubble. It's been hard, and with like language barriers, it's gonna add additional challenge as well. And you work as a physician seeing like foreigners as well. Is that correct? Yes. So our hospital has an international, Department of International Healthcare, which is mainly for people from different backgrounds who don't quite fit in with the normal Japanese medical system. Just to try and give them something more like primary care back home. So is it mostly primary care, or do some people have like underlying complex medical conditions as well? Yeah, so I work with both, and I also work in the Department of General Medicine, which is dealing with Japanese patients who are referred from their usual healthcare providers with things that were too complicated for the primary care doctor to sort out, and that often is quite complex. So we do a mixture. So you talked a little bit about like your friends and community, like how they, how it was like with the pandemic, but how's your like patients coping with this, and can you see any like challenges that they are facing with COVID-19 in general, or like COVID-19 vaccination as well? It's I think the hardest part is that in terms of information, for example, even Japanese people have been very confused about what's going on. I think even for a Japanese person living in Japan, I mean, right now, state of emergency, what's happening? Why is it being extended? Is it being, there was a lot of confusion even amongst that. But I guess the hard part is that when you're not speaking Japanese, you don't know if that's just the way it is, or if that's because you're missing some crucial piece of the puzzle. I think that's kind of one of the hardest things, is not knowing when it's just that no one knows what's going on, or if it's just you who doesn't know what's going on. And I think so a lot of the things at the end of the day, when the patients from international backgrounds were coming to see me, a lot of stuff they were confused about, everyone was confused about. They'd say, I have no medical conditions, and I'm 35 years old. When's my vaccine coming? I can't seem to get a clear answer anywhere on the internet or asking around. And I kind of have to say, well, that's because there really isn't a clear answer on that question, unfortunately.
Yeah, so maybe, I'm going to give a small talk. So maybe we can cover the basics of the COVID-19. Many of the audience may know this already, but I think it is important that we know that. And also having a Japanese friend to help you, I think is really important. And I'm sure your patients really appreciate your presence of, who is a doctor, medical doctor, and can also speak in 2 languages. So I think we need more of you, Nick.
Thank you.
In Japan.
I'll do my best.
And actually, there are physicians like Dr. Jindai who have had training in the US and speak English fluently. So I think we need a way to find them more easily.
Yeah, absolutely.
All right. And then, now I just want to move on to like you are a doctor, but how about like as an Australian, person living in Japan in this pandemic? You only know the life in pandemic.
Yes, yeah. So I'm very curious to find out what Japan is like when there's not a pandemic. I hear there's all these great places to travel.
It's great. It's great now, I think, still, but yeah.
And I want to go to a matsuri. Yeah, there's a lot to still find out. But I guess it's hard because I don't think I've quite had the same experience as other Australians or other international people, because I've been working in a hospital dealing with coronavirus patients, looking after those patients myself, and I was working directly with the Department of Infectious Diseases, so at least I kind of knew what was known about the topic, and when people didn't, when we didn't know, say what's the mortality rate, or what kind of conditions are dangerous, I knew that no one else knew the answer either. So that was kind of at least reassuring. But I think, for most of the rest of the Australian community, I think it was quite isolating, not knowing what's going on. And also, I guess, I think for myself and for a lot of the other international community, the hard part is having this dual life where you're reading a lot of the news stories back home. And let's say, if you're from America and you're reading about, the huge number of deaths and the lockdowns and all this kind of thing, and then you kind of go outside in Japan and everyone's still living their lives normally and there's not quite as severe precautions. It can be a bit confusing because it's being taken much more seriously back home than it is here, perhaps.
Yeah, I totally agree. I think since different countries can be like in different phases or have been in different phases as well in terms of the COVID-19 as well as the vaccination strategy, like vaccination. So I really think we should like learn from each other, but I don't think that has necessarily been done well. For example, back in 2020 March or beginning of March of end of February, I actually already knew from the news in Japan, it must be work of Dr. Jindai too, actually, that, the Japanese government tracked down, like what kind of patterns they see, like in the clusters of infection. For example, it was happening in Yakadabune, or like people in the gym in like closed spaces, or like, even like in a taxi. So they had actually started recommending, if you're using the taxi, ventilate, open the windows. So that was like crucial. But then whereas beginning of March, we were still going to work, even if we were on research, not like working in the hospital. And, I asked, like, I have a little sniffle, like I have some runny nose, like, I think I should stay home. And and they would be like, no, you can still come here. It's not a big deal. And we didn't really know it was actually already happening in the US. So I think it's really crucial that we learn and we actually like tell other countries, like warn other countries. I think we have done that, but I don't know why it didn't get, delivered well enough.
Yeah.
I'm sure there were some challenges, and I think Dr. Jindai was trying to warn the other countries, but that didn't happen well with so many like barriers in between. Okay, any comments on that, Dr. Jindai?
Sorry.
Still here? He's here.
So when it comes to I mean, the trying to find out the risk factors and stuff, right, for the avenues of finding out the clusters, I think many of the concepts has already kind of created or found at the first wave of the outbreak, like starting, I think, March to like May of last year. And, think idea of 3C, avoiding 3Cs, try to ventilate, and then it maybe have some sort of like aerosol, like not just like a droplet, maybe have some sort of like a airborne type, not the really airborne type, like transmissions, excuse me. Then the things is that people or those who work for the Ministry of Health and Public Health Centers are doing trying to find out the clusters, and then the clusters is made in many places, like hospitals and clinics and then nurseries and, as you know, live house, and maybe in a karaoke place, and people and then in things is kept, other things is like in the restaurant. The things is that we have seen is that many there's new type of clusters is coming from many other places. The Yorinomachi cluster, we call it the nightlife clusters. Those the kind of one thing we kind of aware, starting from the first to the second waves, and then the young generation might have the starter, then it's spread to others. Those are the things that we have seen. And other things is that we saw, I guess this is the topic today, but we saw more cases or clusters in the foreign nationals, like those who work for the factory and maybe in the companies. Then I saw the local governments and then Ministry of Health are both trying to do like multi-language type like brochures and then websites, so that let them know what's the important that they can avoid the transmission of COVID-19. So what I'm trying to say here is that idea of 3Cs hasn't changed, idea of cluster isn't changed. The things is we see many other things we haven't thought about it. So that the especially the fact that those people don't speak English, maybe, and in addition to Japanese, non-English foreign nationals maybe have some more the obstacles to get more informations, maybe. So those things we means that I'm mainly in our research right now, not like a Minister of Health, Public Health operation, but people are probably still learning. And if then that things is very important to talk to your cities and towns, because again, I think Saki Sensei will going to talk about it, but somebody in charge of vaccine for you is not a country. Well, they should supply things, but I think actual operation is done by the local jurisdiction. Am I pronounced correct, right? It's like a local government. So again, those things that we see that we need I know we are kind of slow in terms of implementation of vaccines, but I think things is that people are getting vaccine in sequencing in prioritized ways, and then I think it's sometimes you will have a turn for sure, and then for free, right? Then, but I think make sure that if you don't know that, that's the issue, and that's why I think we have those kind of informal, in a sense, informal sessions, so that people understand that the vaccines is important, and also again avoiding 3Cs and clusters. Those are the things that are very important as well. So,
yep,
thanks.
we want to make sure you're still protected until you can get the vaccines. So, Dr. Jindai, how do you think the Japanese government is preparing for that time? I know, like right now, until now, we haven't had enough vaccines, So, but maybe this gave us time to prepare and like think ahead to reach these foreigners who might be high risk.
Felt like I'm a government official, but I'm not. But,
sorry, I'm asking a hard question.
I don't know. I got an interview from some other foreign media, but I worked for the cluster group, but again, this is one of the pillar of that great response, as you know. The vaccine preparedness is in a different, one of the very important, but the different, I think, pillars. And then the sections completely different. So the things I got, everything is coming from media rather than my first-hand experience. So, but anyhow, my individual impression is that they're work very hard, and then but the things is pretty in a very safe side. That for example, in US, I guess they can get vaccine in the farms how to say in English? Let's say
Pharmacy. Yeah, like
farms
yesterday,
like supermarket and stuff. But here, you need to be well controlled. You need to stay for 30 minutes to prevent anaphylactic shock. Sure, that's great, but I think it's like a safe side. But that's a good perk in a sense in Japanese one. So it's a little bit tough to change those things. And then again, the things is that we need more transparency is what's going on. That's the only things that, I got the vaccine a couple of weeks ago, but where I worked for, but it was decided like week prior to that, and nobody knows what happened, but glad I got it. But those are the things, leadership needs to be more outspoken in to say. I mean, that's the more like a Western style, but this is the time we need to know because everybody's speculating, right? So
yes, about the timing as well.
Government conspiracies, theory and stuff. So we need
exactly. Yeah, I think having the information really changes, and with COVID-19, we are delivering lots of information, reliable information in different methods, different social media, that it has to be in different languages too. I did look at the Japanese Health Ministry website, but the information actually is really basic, and people will want to know more. And Nick, do your patients ask about COVID-19 vaccines a lot?
Yes, certainly.
Do they want to know?
Yeah, certainly it's one of the main topics is, when am I going to get it? Where can I get it? And should I get it? I guess is,
when we should.
So certainly, I guess I think in Australia, we have GPs where basically if you just have a question about something like, should I get a vaccine, or really anything, you can just go and make an appointment with your GP, someone who you already know, and just talk about it. So I guess it's a little bit more difficult in Japan, where you have to pick which specialty to go to. I mean, which specialty do you go to just ask if, I saw on the TV that the vaccine looks really scary. Should I really do it? I mean, which specialty is that you should go to? Is that a general medicine or, So I guess when patients, actually, it's often not patients, but just acquaintances who I see around, and as soon as they see me, they're like, oh, I got to ask you, should I get the vaccine? So I think in Japan, it's often hard to get medical advice from someone you trust, which is something that's because of the lack of access to primary care.
Yeah, and we know from like everything that patients, get the information from the most reliable source, and they trust like who they trust, and they follow their recommendations. And in that case, it's like the primary care physician, and they play a crucial role. In the US, we've been delivering vaccines through like, different methods, like the mass vaccination sites or hubs and in clinics. And now the Biden administration said that they're going to shift from the hub centers to the two clinics and like little, like more local places, so that we can reach the remaining ones for a different like strategy. Yeah, so I think our job also in COVID-19 to deliver messages to clinicians as well. All right, so I actually want to ask additional questions for Dr. Jindai. I think we've covered many that I wanted to ask beforehand, but you did mention that there were some like foreigner clusters of foreign nationals in factories and like in other places too. What do you think are the like risk factors, or like why are you seeing more of them now? And in Houston too, we have lots of immigrant population, and they live in like really dense areas in small houses with multiple family members, and that and everything else, so many. But I'm not gonna say all of the the reasons. But why do you think in Japan we're seeing that as well?
So I think the first thing is that the kind of database we use is like the expert try to see the all the website from the prefectural government, how many cases, how many clusters do they have. But I think because they want to, I guess they want to avoid the prejudice or like unintended stigmatization on it, I think they don't report it anymore. Not many. So many things has been coming from like first-hand experience. For me, when I have a clinic by chance, and then I see somebody who worked for the factory has a fever, and then I saw like a couple of cases positive for COVID-19, and then we found that in the media, there's a factory and there's a huge outbreak or clusters. So I think different from the US, I think for example, the social determinant of health in US is very important. Like, for example, African American population has more death compared with white population, and then like immigrant workers are more susceptible, whatever. That's a very typical topic in US in like epidemiology and those who do public health. But in Japan, again, this is my individual, my opinion. It's not like government's opinion, just my opinion. Is that
everything you say stays here, and it's your words.
It's not tough to get those information seriously, but I think those type of media, and then like old media, like TVs and newspapers are very important to show that there's things going on. But I think given the those media reports are increasing, so I am assuming, and I'm sure that there are a large number of people be affected, because Japanese are affected as well. And then there are about 3 million foreign nationals living in Japan.
Mm-hmm.
I think that we have done, and then government have done, and many NGO are done, but we need to have some good message to them, and we need to, because again, if it is like American style, it's because there's something, we need to have good interventions, to those populations. And we
Yes.
have brochures and those things. So this is a small step, but that's why I love to hear to discuss those issues. Again, this is a little bit informally. I think minister says, well, yes, and then like when you take a look at the expert resources in online, like from Minister of Health or Kante, I forget how do you say in English, but
Prime Minister's
yeah,
office.
a couple of sentences that we need to do something for the foreign nationals, but they do it and then they are aware. Well, but again, I feel like they are just afraid that things can goes to wrong directions, not the support and help them. So, but anyway, so am I answering your question? I'm sorry.
Yes. And no, thank you. This is great. And I think transparency is very important. You mentioned about like how many, like 300 foreigners. Oh, I don't know how many you said actually, but there may be like certain number of foreigners, who are getting infected. It might be nice to know like that details too, so we can know what the risk factors are, and like maybe we can reach them as well. Not necessarily foreign nationals, but like specific like occupation, for example, like things like that. Anyways, I think it's time to move on to my little talk about the actual like logistics and how and where you can get the vaccines. And this covers some of the questions that you've asked in the chat box as well. So important key things. I think Dr. Jindai already mentioned some of it as well, but COVID-19 vaccination is free of charge, so you don't have to pay for it. And local jurisdiction is responsible to assist you. And they should have phone numbers that you can call, or you should be able to gather information online. However, lots of the information out there are going to be in Japanese, unfortunately. So please ask your Japanese friends for help. And if you are Japanese listening to this right now, if you could assist or like reach out to your foreign friends to see how you can help. And as you've been doing already, please ask any questions about COVID-19 vaccine or like share helpful resources or websites with us in the YouTube chat box. All right, so I'm actually in charge of our great COVID-Navi Instagram. I'm working with like lots of partners, including Ms. Anna Matsuoka, who is a volunteer designer. Everyone is doing this for free. And she actually has made this nice Instagram post regarding how many are vaccinated. So who has received the first dose. So this is data actually from May 3rd. We post this every Wednesdays. And in Japan, we've vaccinated 2%. 2% of the population have received the first dose. In the world, it's almost 8%. And then in the US, it's 45%, but actually it's more right now. So it has been a slower process. And this is the plan for the vaccine rollout. As you know, we have vaccinated the medical workers, or started to vaccinate the medical workers starting on February 17th. And there are 4 million of us. And then we've started vaccinating those over 65 years of age starting on April 12th. And we are planning or hoping to complete vaccinating the elderly above 65 by the end of July. And we will be transitioning to other people, including those with health conditions that increase the risk of severe COVID-19, workers at long-term healthcare facilities for the elderly, and then those who are from 60 to 64 years of age. And they'll be delivering vouchers or coupon first, or they call it coupon, and then start vaccinating these three groups. And all the others are going to be as able. And somebody asked in the chat box what kind of eligible underlying medical conditions are there. And so here is the list that the Ministry of Health has provided for us. I'm not going to go through all of them, but this does include obesity with a BMI over 30 and many like health conditions of critical organs, diabetes, sleep apnea, and then immune problems, and also severe mental illness as well.
Sensei, I'm going to talk about the how government knows that they're risk factors. Those are the risk factors, because that's I think the questions from some of them are asking the question.
Okay, yeah, if you want to answer that.
Oh, well, I think there's no such things. People, government are aware. They are not sure that, for example, I have a diabetes, I have obesity, nobody knows. So that I am assuming is that probably they're gonna send the questionnaire or some sort for everybody who are eligible, and then it's the pretty much self-report, I think. There's nothing with social security number or hospital records or whatsoever. So probably self-report, but I'm not sure how they make you or have you report your disease. Actually, I think.
Yeah,
so,
I have to check on that. When I have a family member who is obese, so I actually checked online, and it in my area it just said self-report in Japan. So I think that is the case, but I need to check on that. And actually, somebody's putting in the chat box. All right. Anyways, so steps for getting the vaccine. Yeah. So my friend actually told me that it is self-report, so you don't have to have any proof of that. All right, but please be honest though. Steps for getting the vaccine. So as I mentioned, you will be receiving a voucher sent to be in the mail, and this is going to be sent from your municipality of your residence. So you don't have to do anything. They're just going to deliver that to you. And again, the vaccination is free of charge. And in the information sheet, so voucher comes with an information sheet, and the information sheet will have lists of like available venues where you will be able to get the vaccine. It might be like a hub or big vaccination sites or mass vaccination sites, and it could have certain clinics as well. So I'm not sure what language this is going to be, but I have a feeling that it's likely going to be in Japanese only. And again, it will have phone numbers that you can call, or like a online website. But there is a website, this was in Japanese only, but called VSIS, or Corona Vaccine Navi. And you can search for the vaccination venues in your district. But this was only, as far as I know, this is only in Japanese as well. And on the day, so they're saying that if you have fevers or acute illness on the day, you cannot get the vaccine, and you do need vaccination voucher and ID. And ID can be things like your passport, driver's license, My Number card, or health insurance card as well. And you will be able to fill this out at the site, but there's vaccination questionnaire that you can fill out. And I think it's easier to wear clothing like what I'm wearing, that you can have your sleeve up really quickly, and to make it easier to receive the shot. And the screening questionnaire on the Ministry of Health, Labor and Welfare website, there were lists of questionnaire in different languages. And so you might want to print this out and fill out at home and take it with you. And all these links, I'm going to put it in the YouTube comments later on, so you have access to that. And then you do need to schedule the second vaccine. So the one that is approved in Japan right now is Pfizer. So that would be 3 weeks. There is like a little grace period. So it's usually the 21 days that you can actually get it if it's 19th day or after as well. But the ideal is 21 days, because that's what they did in the studies before the approval to confirm safety and efficacy of the vaccine. All right, so I want to share some vaccination website with useful information with the vaccines. So Conte, the Prime Minister's office website, have this information in English, like information on COVID-19 vaccines in English. So this will be a good resource for you. And then Tokyo Intercultural Portal site had information with brochures in different languages, not just English, but Chinese, Korean, and many others. And actually, this is what Nick told me, but the Japan Times had a nice overview, similar to what I have talked about today, but had a nice overview of what to expect. And then other like resources in COVID-19 in general. Like Dr. Jindai said, Ministry of Health is trying to deliver information in different languages. They acknowledge that this is important. So there were some brief information material on COVID-19 in different languages listed here. And here's some examples of how it looks like. And there were some calls, there were not phone number that you can call, and it does provide, they do have call centers in several languages as well, but which are listed here. So a little bit limited, but they do have some languages that you can call in. And when I clicked the Korean, they actually had different phone numbers for different jurisdictions. So that I thought that was really helpful. And maybe perhaps you can ask about COVID-19 vaccines there as well. All right, so that's all I have. And again, feel free to ask questions in the chat box, and you may have. And we're going to move on to some Q&A sessions, and we'll be happy to answer your questions there as well. All right, let's see. Actually, so Nick, you just posted like a comment in the chat box in the Zoom.
Yes, so I put that in the YouTube chat as well.
Oh, YouTube. Oh, perfect.
I was just trying to get an official, so because this is the actual vaccine website of the Japanese government, giving us, you know, an official word on, well, you know, how am I going to prove that, you know, I have this condition? And particularly this question was saying, do I need a shindansho, you know, which is what Japanese patients usually, like, if they want to prove that they've got a condition to their work or something, they would usually use for that. But yes, basically this website directly states, no, you do not need to bring an actual document stating your condition. You just need to, so you're sent out the pre-vaccine questionnaire, which I assume that they'll just send to everyone, and then you just tick the box that says, I have this medical condition. And certainly, yes, we've had follow-up questions about, you know, what proof would I need to provide. I assume that some jurisdictions may choose based on what you've written, if it looks a bit unusual perhaps, or they feel they need more information to decide if it's safe for you to be vaccinated, then they may ask for more information. But in the vast majority of cases, I assume it's just going to be taking people's word for it, because as has been said, in Japan, there's no centralized system where the government can check what conditions people have. And yes, and one poster was said that they were asked to bring medications to the government office. Yes, I have no idea. Perhaps a local government office has decided to do it that way, but it would sound very bizarre to me because some of these conditions, like obesity, for example, you know, or even hypertension, you may not be on any medications at all. So I don't anticipate that there'll be a lot of requirements for proof. And if there was a requirement for proof, I imagine it would come in the form of asking for a shindansho, but in rare cases.
Yeah, right. So go ahead.
I very understand their frustration, and even like as a healthcare workers, I didn't know when I get those vaccines, but I think they are working on it. I hope, I believe they're working on it, but I think they are now super busy in how they give them a vaccine to elderly population. I think they run short of staff and stuff. And then I think they are working on it. And then I think on the time. I hope like in a couple of weeks or so, they started showing what exactly that they when I find out those who have a pre-existing conditions, I think. So I think the information will be evolving, I hope. So just keep vigilant. I'm sure that those who join this session is very savvy and on top of everything, but good to see their website now every now and then, and those are the things I would do so far. Sounds like we do not need like proof or whatever. Sounds like I read the very Japanese like expert meeting back in December, and they do specifically talk to the government that we should do a self-report rather than diagnosed by somebody. So it's in Japanese. I can find out, but just make sure that they will be. I hope that they're gonna show something in very close future. But again, I really understand your frustration.
Yeah, so I agree. And this is the website, the link that Nick posted. It's from the health ministry, like Q&A, so you don't need a proof to show for your medical condition, underlying medical condition. So no proof is needed. And this it's in Japanese, but this Q&A from the health ministry website is really great. I wonder who is which organization might be assisting with this, but they do have wonderful questions and answer session. So please check this out as well. But unfortunately, this is only in Japanese, but underneath they do have some phone numbers for you to call, phone number for you to call as well. But I think they could.
I want to just throw in there as well that for people who aren't using it already, a lot of us use something like Google Chrome's auto translate feature to access Japanese websites that are only written in Japanese. It's not perfect, but it often at least lets us get the message across when viewing these websites. So yeah, if anyone's not using that, that's a good way to read Japanese websites if you're not Japanese speaking.
Okay, so I think you do need to set the language, right, on the Google?
Yeah.
Oh, nice. Okay. All right, so I just translated into English.
Yes,
but
there we go.
Whoever created this, they should have written in next to the Japanese language word, they should have written the language, the language name in their own language too, because otherwise people won't know. So a feedback that we can provide to them. All right. Okay. I was going to say something. Oh, yeah. Regarding the medication list. So in Japan, we have a okusuri techo, but that shouldn't be necessary. However, some jurisdictions may say it might be better. So if you have that, just take it, just in case. And the questionnaire that you fill in do have a place where you do list medications or your underlying medical conditions. But the important thing is, actually, whatever medical condition that you may have, most of the cases you actually can get the vaccine. Those who cannot get the vaccine are those who have immediate allergic reactions or severe allergic reaction to the component of the vaccine or the vaccine itself. And everyone else, this Pfizer vaccine is very safe for you to receive and very effective as well. But as a routine in Japan, we do ask these questions, and the doctor will be checking that before you are vaccinated as well for precautions. All right. So any other questions that I have to go to the chat box. Let's see what website we've shown. Were there any that you saw, Nick or Dr. Jindai?
Yes, just another question from Sarah about, do you self-report when you sign up to get the appointment, as her husband didn't have any questions about his illness. So certainly when I got my coronavirus vaccination, the Pfizer vaccination, there was just a quick questionnaire that I did as part of it. And one of the, it was like, what's your name? What's your date of birth? And then kind of in the middle of that, there was a bit that sort of said, do you have hypertension? Do you have, heart disease, et cetera, et cetera. But that's it. It was all in Japanese. So I'm not sure if we're getting an English version of that, and it's not kind of highlighted or anything, so it may be easy to overlook.
Okay, so
there we go, got that.
Yeah. So in the, I showed this in the presentation too, but this website of the Ministry of Health, they do have the questionnaire. So the same questionnaire that Nick mentioned in the language listed here. So, and this is very unique to Japan. And we usually do have a questionnaire like this that you fill in before receiving any vaccine, including like flu vaccine. But some questions are going to be different, like are you receiving the COVID-19 vaccine for the first time? And you do list what kind of group you belong to for the eligibility. And here are the disorders that you check in. And these are routine questions that they ask for any vaccine again. But the illnesses, this is different from the, like the eligibility, I think. And this is the part that you write about what eligible underlying disease you have. And then the below is actually just like routine questions before you get the vaccine. But everything listed here does not prevent you from getting the vaccine. And many of the conditions here, actually you should get the vaccine to protect yourself, because if you have many of these and get COVID-19, it can cause severe disease and sometimes kill you. So it's important that those groups of people are protected. And if you have immune deficiency, COVID-19 vaccine, the Pfizer mRNA vaccine, is not a live vaccine. So it is safe for you to receive it. The only caveat is that you may not have a good immune response because your immune system is compromised in the first place. So it may not work perfectly for you, but it is safe. So even if you receive the vaccine, you should be very careful not to get infection. All right. And then there'll be questions about like blood thinners and stuff. But even if you're receiving medications like aspirin or warfarin, you can still get the vaccine, and they'll just like compress the area that you received the vaccine. You got the shot for more than 2 minutes. So in order to make sure you don't get bleeding. All right. Are we good on this? And at the vaccination site, a doctor will check this for you and say, yes, you can get the vaccine. Oops. All right. Thank you for that. We have 3 more minutes, but sorry, I closed my YouTube. Do I have the YouTube site? Okay. Let's see, other questions? I think we're good, and other like Kuminavi members have answered their question as well. All right. Any final comments or additional comments? It's actually is toward the end of the time. Actually, there's additional question. So regardless of pre-existing conditions, one must wait for the age group time slot first, correct? Then one might get priority within the age group. I realize you might not have the info. So actually, so first, right now, it's those who are 65 and over, or medical personnel. And after that, they're going to shift from people with any age over 16. So the Pfizer vaccination clinical trial was performed for 16 years and older, the initial one. So if you are over 16 and have the underlying medical condition that I listed, you will be eligible, whatever age you are, you'll be eligible to receive the vaccine next. But we're not at that stage yet. That will be the next one of the next groups to come. So I hope you and your family who do have the underlying medical condition will be able to receive that as soon as you can. All right, so thank you for that great question also. All right, anything else? Anything else, my COVID-19 friends, that I should answer? Okay, it's actually, yeah, it is 8:30 for me in the morning, but 10:30 p.m. for you in the evening. So I think we will close here. And thank you again for great speakers, Dr. Nick and Dr. Jindai, for joining us. It was a lot of fun. And thank you for everyone who's listening to this now. We did start this in English, but like we've all said, we don't want anyone to be left behind in this pandemic. English or Japanese might not be the first language, and you might, want information in other languages. I actually don't have that skill, but we do have lots of people in Japan who do have that skill. So I am hoping that Kobinabi can work with other communities so that we can reach out to them for like people with different backgrounds and those who speak in different languages. And right now, the problem is that we don't have enough vaccines to vaccinate all of us. And the process is slow and frustrating, but someday soon it's going to be available to you. And when it is, we wanted you to be ready for that. And I hope we provided some basic information today for you to be prepared for it as well. And I would like you to we're going to have this YouTube live on our YouTube website as well. So please tell your friends about this so that they can receive the information that you received today. All right, could I have final comments from you two? Nick, if you don't mind starting.
Yeah, thank you, Seki, for such a great informative presentation. And yeah, I guess if any people have any questions that come up later, what's the best? I mean, obviously, feel free to leave a message on my Twitter or whatever. But is there a? I guess if someone in the foreign community thinks of a question later or watches the recording of this and then thinks of a burning question they want to ask, where is the best place they can ask that question?
All right. So we actually have multiple ways. So since since this is it's going to be related to this, feel free to write in the comments of this YouTube chat. There's going to be recording of this there. Or we are doing different social networks. So I'm in charge of Instagram, and we do look at the messages that we receive there. We may be slow sometimes at responding, but we are reading that. We do have a questionnaire on our website too, for actually more for the media who want to reach out to us. And then Twitter might be good, and Facebook, not to forget Facebook as well. So there are actually different ways that you can reach out to us. And that this YouTube chat box might be the best way, since we'll be paying attention to those with different cultural backgrounds. All right, thank you for that. All right, Dr. Jindai?
Oh yeah, thank you very much for having me here. And I think one thing is that very important things as people means that experts like Dr. Oshitani and expert committees and government are aware that there's a clusters in foreign nationals, and then they are aware that we need to give the vaccine. That's why I think they have their own website. But I think things again from people in Western US and European countries, we are not that good at in terms of the conveying those information in a transparent way, but we do aware, and then we do use facts and writing, and then we don't have a like tech savvy yet in terms of the public health response. But I hope that having those sessions that we see more people that the more like good information sources, so that they can help support their, I think, communities, and to get the vaccines, and then to get stay away from the transmission of the COVID-19. So again, thank you very much to have these great sessions, and I hope that I can join again soon. Thanks.
Yeah, thank you so much. Absolutely, I totally agree with your comments. And yes, we do want to reach out to you. So, all right, thank you for this wonderful time. And I hope we can do this again and answer more of your questions as well. So thank you for joining. And goodbye.